Okay, this time it's gonna work. I promise you. Oh my gosh, I feel so bad. But hey, third time's a charm. And if you really want to get something done, you don't give up, right? Right. Okay, I don't know where all of you went, but hopefully you come back. And let's see if this works. Okay, here we go. Thank you guys for coming back. I appreciate that. This time it's gonna work. I think it was the orientation of the phone. See, there's two different options for lives. You can either have it straight and then there's like the other person is like a little box, or you can both be landscape and then you're both next to each other. But some people's phones hate me and that's it. So we're just gonna wait for him to get back on. Hey guys, thanks so much for coming back. So just as a preface, we're gonna be talking about all things plastic surgery. I'm gonna approve this and hopefully it will work. Let's all pray for just a second. Okay. Okay, there we go.
Hey, now it works.
Okay.
Perfect. There are some technical difficulties.
Yes.
I think I'm.
Yeah, I'm
going.
What happened?
I'm echoing.
I'm echoing. Can you hear me?
I can hear you okay. You're not echoing on this side.
Okay.
Okay.
All right,
Awesome. So I'm going to have you do most of the talking.
Okay.
Hopefully they can understand me.
Okay,
So why don't you tell us a little bit about you so that they know you're not just some random guy?
Well, I'm just some random guy, but I happen to be a plastic surgeon also, and I'm in Englewood Cliffs. My name is Gil Altman, and I'm happy to be and proud to be friends with Ray now. So I'm going to talk to you today a little bit about abdominoplasty and tummy tucks. Same thing.
Yeah.
Okay. Well, why don't you tell us what the two most common procedures that you do are besides tummy tucks?
So I do a lot of breast augmentation. Breast augmentation is probably my number one case that I do across the board. And it goes back and forth between abdominoplasty as my second and then liposuction also. So it's really body contouring. And then I do a lot of rhinoplasty. So all things aesthetic.
Okay. And so tell us a little bit about the muscle separation and what causes that.
Okay, so what Ray is referring to is something called diastasis recti. So a lot of women that have had children, you'll notice when you work out or when you're sitting up, all of a sudden, even though you're anywhere from 6 months postpartum to 6 years postpartum, you'll see a bulge going up and down on your midline. And that bulge is your muscles separating. So quite literally, if you think about it, so you can see my fingers. So these are your rectus muscles. And when you get pregnant, your uterus distends, your abdominal wall has to come forward, right? So those muscles, instead of being a six-pack where you see the joints of my fingers, they separate. And so what you see coming through them is the abdominal content. So it's almost like a pseudo herniation of the abdominal wall through those muscles. So when you do a tummy tuck, part of what you're doing is you're bringing those muscles back together again. So that's just not cosmetic, that's also functional, right? Because if you try to think about looking at a bridge, everybody's seen the George Washington Bridge. So those cables go like this, right? And they're bowed. So if you were to take those cables and you were to put them going straight across the top of it, that would make a much more rigid function between the two of them. So with your abdomen, once you bring those muscles back together and now you've got to try to do a sit-up, it's going to make it much more effective. You can sit up, you can be strong again the way that God made you. The muscles are back together, not apart. They're not supposed to be apart. You need them together.
So what about all these people that say you can fix it with exercise?
I'm sorry, say that again?
People who say you can fix it with exercise.
You can't. In fact, if you keep going, I think exercise will make it worse, right? Because every time you try to do a sit-up, those muscles go apart. They go apart. They go apart. So just like pregnancy, where it's this constant need to push on it and bring it forward, the exercise is going to do the exact same thing. Those muscles are going to stay to the side, and there's no exercise in the world that's going to bring that together. Now, you know, because we've spoken about it privately, that I'm the biggest proponent of exercise in the world. I'm in the gym 5 days a week at 3:30 in the morning, so everybody should exercise and it shouldn't stop you. However, this particular problem can't be solved by exercise. The only way to fix this is to mechanically put it back together again.
Right. And I hope all of you heard that. You cannot fix it
with exercise, but you still can exercise.
Yeah. Okay. So what if someone has this, right? And they want to have more kids before they do this surgery? What can they do to prevent it from getting worse?
So There's nothing you can do to prevent it from getting worse. You can do a couple things. So you definitely don't want to fix this if you're going to have more children, because otherwise you're going to go through this operation, the pain, the expense, everything that's involved in it. And in all likelihood, it's going to repeat itself. It's going to fail, right? Because if you have enough pressure from the inside, the baby's going to win, and the baby's going to win every time. And so eventually those muscles will go back out again. So what you want to do is, in between pregnancies, during pregnancies, up to a certain extent, you can try wearing an abdominal binder. So that type of corset binder will help to kind of keep things in the middle externally, if you will, right? So it's kind of giving, it's almost like the muscles are being external. But the initial problem, right, the etiology of it is that it's still, those muscles are still splayed apart.
Okay. So someone decides to do the surgery,
Okay.
and people are like, why would you go under the knife, without needing to? And they shame people, whether it's having a tummy tuck or having their boobs done or whatever it is. What would you say to women who shame other women for doing something like that?
Okay, so first of all, no one should ever shame anybody else for anything. That's number one, right? We never know anybody else's battles. We have no idea what trials and tribulations anybody else have gone through, so you should never shame them. In my world, I hear this all the time. You're a cosmetic surgeon, you're taking people to the operating room when it's not a medical necessity. And my answer is kind of simple. If you pull everybody that's watching this cast right now, there's 22 people on right now, right? And everybody looks down at their feet right now. If you're wearing socks, I bet you your socks are matching. That's the first level of vanity. Why match your socks? Who cares? Because it's socially acceptable, that's why. And if I can do something and keep it safe and make your self-esteem as a woman go from here to here, guess what? I don't call that aesthetic surgery. I call that great medicine. I helped you. And so I don't care whether it's a breast implant, a rhinoplasty, or an abdominoplasty. All of it, if it's going to help your self-esteem and it's going to make you feel better about yourself, I think it's a great thing. I really do. It's a great thing.
By the way, you mentioned pain before.
Okay.
It's not so bad.
Okay, so I think the pain is really subjective, right? So, for instance, on my breast implants, the breast augmentation of yesteryear, people were like down and out for 3 weeks. I've had patients that I've done breast augmentations on now that go out for dinner that night, right? So in the recovery room, you can raise your hands above your head. You can take a shower the next morning. It's not like it used to be. It's a very gentle procedure, and you're very careful going in and very careful going out. And the more gentle you are as a surgeon, the faster the patient's going to recover. And it's going to be the same thing for the tummy tuck. There are many variations on the theme for an abdominoplasty, but it's the same principle. If I'm going to be gentle what I'm doing on the inside, it's going to translate to less pain post-operatively.
Right.
So you can attest to that. So it's uncomfortable and you'll feel tight and you're going to be bent over, but you want to be. If I take out enough skin and I tighten up those muscles, you got to know that. So you can bounce a quarter off your stomach right now, right? But now you're not in any pain anymore. You're almost 2 weeks out and now you're okay again. So I would rather have 3 or 4 days of discomfort and now a lifetime of being able to sit up and having my abdominal muscles back there where we're supposed to be than to deal with a lifetime of back pain because my stomach muscles don't work anymore.
Exactly. So with let's say a tummy tuck, what should people expect from beginning to end, like in a few different steps?
Okay, so let's start off before you even get to the operating room, right? Let's start off in the office. So I have people that will come to me that are 60, 70 pounds overweight, and they want to do a tummy tuck, they want to get rid of the skin, and they're not even really talking about the muscles, they're just kind of want to get rid of the extra skin. And my recommendation to them is you got to lose weight first. You got to get to a certain point so that A, you're going to be healthy, and B, you're going to have a good result. If I take you to the operating room and you're 50 pounds overweight, and I bring and I suture it and I technicate, you're not going to be happy because you're going to eventually lose that weight. And now there's going to be a discrepancy between how thick the abdominal wall is on top and then above the pubis, which is going to be flatter. So that's going to be the first thing. So I counsel everybody on the importance of diet and exercise, right? It's healthy, makes you feel better, it makes you look better. Now let's get to the point where you're already there and you're ready for the surgery. I explain to everybody what the process is and what's involved in it. 90% of the times we use drains. And I tell everybody I'm going to see you before the surgery, and I'm going to mark you. Okay. I'm going to have you stand up, and we're going to follow the line from your hip to your hip, and you want to keep the incision as low as you can. You want to be about 7 centimeters above the pubis. So I explained to also everybody about the belly button. Everybody thinks their belly button gets moved, and their belly doesn't get moved. And I'm going to try to reposition my camera for a second here, so bear with me. What I want to show you guys is an illustration of exactly what happens with the belly button. Give me 2 seconds. Okay. So if this is your belly button, Ray, can you see this clearly?
Yeah.
Yeah.
Okay. So if this is your belly button and this is where it was on the stomach beforehand, what you're doing is you're cutting around it, you're lifting all this up, you're sliding it down, and you're bringing it back. So your belly button stayed in the same place. It's the skin that was around it that gets moved down, and then you get put the new belly button. So the belly button isn't really new per se, as much as it is being repositioned of the skin that's being redraped on it. So I want everybody to understand that as you're going through the whole process of it and everything, what's uncomfortable with the tummy tuck, and again, it's not a terrible pain, is when you put those muscles back together. So once I'm done marking you and we actually go to the operating room, at that point, you don't remember anything. You know, we have great anesthesiologists, you're drugged, everything's great, you don't know what's happening. Until you wake up in the recovery room, you felt nothing. And so the part that's uncomfortable is when you put those muscles back together again. And they get back together with a very soft but permanent suture in 2 layers. And the reason why you do 2 layers is because you don't want anything to pop and then have an unevenness or a bulge or anything like that on the abdominal wall. You want it to be totally flat from the bottom of your breasts all the way down to your pubis. The rest of it now at this point, now this is cosmetic, right? So we've fixed the muscles. That's our functional part, right? It's like a Porsche car, right? They always say form over function, function over form. It's the exact same thing. So you're taking something, now you've repaired the function of it. Now I'm going to improve the form. There's no reason to walk around with all that extra skin, and in fact, it's detrimental to your back. When you're standing, you want to carry yourself upright. So if you have all of that extra skin hanging down below your waist, now it's pulling on your back and it's pulling on the top of your pelvis. It's not where it's supposed to be. So what I'm basically doing is I'm kind of cutting off all of that ellipse and bringing it back down. So now on top of the muscles that are repaired, now you don't have that redundant skin. And so getting back to the exercise, what happens is, and which people find great, is after losing that skin and having those muscles repaired, it turbocharges your workouts. Because now what you couldn't do before, you can do. You're not tucking the extra skin into your pants and your undergarments and worrying about how it looks inside of yoga pants and exercise pants. All that's gone, you're flat, okay? Most people get 1 or 2 drains. What do the drains do? Okay, I'm going to put you back down again because I need to illustrate with my hands. It's the Jewish in me. I need to talk with my hands. So when you're on the table, that skin, I'm going to go sideways, gets elevated off, brought down, and then cut off, okay? When you elevate it like that, it's creating what's called a dead space. And all of that stuff inside of here, this is where your belly button comes out of, is going to secrete fluid. So you put those drains in to collect that fluid, and the purpose of collecting the fluid is so you don't develop what's called a seroma. You don't want fluid to develop underneath that abdomen and then not be able to escape. So you take out the drains, and eventually it stays so dry, the fluid, it decreases. And I told Ray before, so it starts off as like a Bordeaux, and then it goes to a Burgundy, and from a Burgundy it goes to a Cabernet, and from a Cabernet it goes to a Zinfandel. It gets lighter and lighter in color until it almost turns into a Chardonnay. It's almost like a straw color. Then you take them out in the office. It doesn't hurt to have the drains removed, and they definitely serve a purpose.
I mean, I'm still swollen right now, right? So when do you see the swelling go away completely?
Okay, so for complete swelling to go down, you're probably looking at somewhere from 8 to 12 weeks, right? So it's nice that it continues to recover, and you'll be able to attest to everybody that you'll see a chronic progression of this, of how it's doing better. Every once in a while, once you remove the drains, there'll be a little fluid left behind. You can drain it right in the office, so that's not a big deal. So you just want to continue to keep up your daily activities. You can't work out your abs for 3 months afterwards, and the reason for that is you want that skin to be stuck down to the underlying muscle, so that dead space completely heals and closes.
Can someone ruin their muscle repair?
You could ruin your muscle repair if you try to do like hanging leg raises or crunches on post-op day 1. But other than that, you can't ruin your muscle repair. It'd be very hard. That suture is really strong.
Okay. And
People are asking where you're located. I'm going to tag your information below.
Okay, so I'm right in Englewood Cliffs, 570 Sylvan Avenue. I have an office there, and I've got a state-approved operating room in Paramus, which is really easy to get to. It's right off Route 17, 1 West Ridgewood Avenue in Paramus. And that's a first-class facility. My staff there is second to none.
I can attest.
Yeah.
And so do you have any closing thoughts for people who are thinking about having any procedure? Maybe they're scared and maybe they're nervous about doing something like this. Maybe they feel like it's selfish. What would you say?
So my first thought of that is, I think it's normal to feel scared, right? And that's good, and that's healthy if you feel scared, because if you're going to undergo surgery in a life-changing event, you want to think about it. You want to give it enough weight and enough attention that you're going to go through all the critical steps of asking all the questions. I will tell people, and again, you can attest to this too, I think the biggest hurdle is not the surgery. I think the biggest hurdle is getting into the office for the evaluation. That's the part of it that really, you're kind of putting everything out on the table. You've taken that step, and now you're really exposing yourself to the world, so to speak, that, you know what, I'm going to take this step and I'm going to fix myself. So that's the biggest hurdle. Once you make that decision that this is what you want to do and that you're a candidate for this, the rest of it, I think, really gets a little easier. Like, you really weren't nervous the morning of. You were already calm at that point. I think the nerves were gone. You were resolved in your decision making, and that's great.
Well, thank you. I'm gonna eventually have an after picture that I will post for everyone.
That'll be great.
And I appreciate your time, and I hope that Black people make the right decision for them and go to you and take care of this issue.
Yep, that's awesome. Thank you, Ray. It was great. You're an awesome patient. It was an honor to take care of you.
Thank you. Talk to you soon.
Everybody, take care.
Bye.
Bye.